The common adverse effects seen with the heparin are the hemorrhage, skin necrosis, thrombocytopenia, and hypersensitivity reactions. Now, the main side effect of heparin is bleeding. Due to this, heparin should not be given to the patient with a hemophilia, thrombocytopenia, or peptic ulcer. Because it has a very short duration of action, between 4 to 6 hours, bleeding can usually be controlled by stopping the drug administration. If necessary, heparin can be neutralized by the intravenous injection of protamine. Now, protamine is an antidote and it is a basic peptide that combines with the acidic heparin and neutralizes its effect. Now, heparin occasionally causes the allergic reactions. There is another side effect that can be caused by the heparin. It is the heparin-induced thrombocytopenia. Heparin may also act as the heptin. Now, what is heptin? Heptin is any molecule or small particle that can elicit the immune system. So, heparin can elicit the immune system and cause the formation of HIT antibodies when it is bound to the platelet factor 4. Now, HIT means heparin-induced thrombocytopenia. These IgG antibodies form a complex with the heparin and platelet factor 4 in the bloodstream. Now, the tail of the antibody then binds to the Fc region on the surface of the platelet. This results in the platelet activation and the formation of platelet microparticles, which initiate the formation of blood clots. The platelet count eventually falls, leading to the thrombocytopenia. Now, in addition, the reticuloendothelial system, mostly the spleen, removes the antibody-coated platelets, further contributing to the thrombocytopenia. Now, direct thrombin inhibitors are used for the treatment of the HIT. Heparin-induced skin necrosis can also occur in some cases. The proposed reason behind this side effect is the intravascular thrombosis as a result of HIT, cutaneous vasculitis caused by the type 3 hypersensitivity, and disruption of the vascular supply due to the poor injection technique. So that was all about the heparin. We discussed that it is an anticoagulant that is given through the injection route or the parenteral route, including the IV and the subcutaneous. Hopefully now you got the answer of question why heparin cannot be given intramuscularly. Because there is a risk of hematoma formation. Now, hematoma is a collection of blood outside of blood vessel. Most commonly, they are caused by an injury to the wall of vessel. Well, you already know that muscles are rich in blood vessels and heparin increases the bleeding tendency. So, intramuscular route is avoided. If you have any further question, you can comment down below. I am available on sqadia.com for you to answer.